Hi everyone, is your wellness buddy, your favorite nurse. How you guys doing? How my wellness buddy fans doing today? I hope you're well, I hope your family is well. Welcome to today's video. So is in a continuation of the topic we already started, and that is infertility. If you've not seen my previous videos on infertility part 1 and part 2, I crave your indulgence to please go watch it, see those videos, infertility part 1 and 2, and share them out just so others can also benefit from the video. Share them out, okay guys? So today we're going to be talking about the causes of male infertility. In my previous video, we treated the causes of female infertility, as well as the general predisposing factors to infertility as it affects both the male and the female. So please go see that video, okay? So today is majorly for the male. We're going to talk about the causes of male infertility. And one of the major causes of infertility is of male factor. Research has proven that 50% of the causes of infertility are male related. So yeah, it's not only about the female, it's majorly a sperm problem from the male, either a low sperm count, an abnormally shaped sperm, or a sperm that is not viable. So you now know that ejaculating is not enough. What I mean is having sex and reaching orgasm is not enough. You have to be able to produce the adequate amount of sperm that it takes to fertilize, to get a woman pregnant. The sperm should be well formed, has to be well formed, and it should be active, it should be viable. That's what we mean by viability. It should be motile, it should be able to move the way it ought to move. So as regards to, or in regards to the causes of male infertility, the major factor is a low sperm count. Known as oligospermia. We'll talk more about the kinds of abnormalities of the sperm later on in this video. So I just want to highlight quickly other causes of male infertility. And one of those causes is varicocele. Varicocele means enlarged veins in the scrotum. Of course, you know that scrotum, you know your scrotum, men. This boils down to what I keep stressing about. Your body is your body, is owned by you, and you have the right to examine yourself, because you are the only one that can tell when you are feeling differently. When you're feeling differently, you have a different feeling from the normal. You're the only one that can tell. So you must examine if there are varicose veins, very enlarged veins down there in the scrotum. You'll be able to know. If you find that, please see a urologist, seek medical advice, because that's the only time you can find a solution to your problem. Another one can be chromosomal abnormality. Another one can be undescended testes, known as cryptorchidism. This is calls for a need to still examine yourself. Some of our men are existing without their testes. Some know about it, some truly do not know about it. Feel your scrotum. If you can find those two balls down there. Some have just one, while some do not have at all. If you do not have at all, speak up. Though if you're an adult already, by the time you discovered, then there's little or nothing that can be done. But yes, examination of your scrotum is very important, as well as your testes. Mothers, fathers, examine the scrotum of your little ones for their testes. Make sure it is in the sac, in the scrotal sac. Make sure it's there. If it's not there, seek medical advice. A stitch in time, they say, saves 9. And then another cause of male infertility is low testosterone, known as hypogonadism. Another one can be infections, untreated sexually transmitted infections that has lingered on. You're feeling differently. You keep doing self-medication, taking over-the-counter medications. It will not help you. It's just going to do you more harm than good. Another cause of male infertility also includes misuse of anabolic steroids. Anabolic steroids are muscle builders. Hey, our men, you want to build those muscles, you want to show off, and then you find yourself taking anabolic steroids the way you should not take them. While is helping you build your muscles, is reducing your ability to father a child. So please take with caution. Another point for male infertility is sexual dysfunction, which also brings in that topic we first talked about, erectile dysfunction. Please also go down, see my video on erectile dysfunction, retrograde ejaculation, premature ejaculation, and an ejaculation. There is no ejaculation at all. Those can be a cause of male infertility. And then surgical or congenital abscess of the testes, and then previous chemotherapy or radiotherapy. If you were once a cancer patient or you are still on cancer treatment, it may reduce your ability to father a child. It could be a cause. Okay, so yeah, that is that in regards to the causes of male infertility. So I want to get a little further now. I want to go a little further today to talk about the numerous kinds, the various kinds of sperm abnormalities. The first one I'm going to talk about is oligospermia. Oligospermia simply means low sperm count. It means you have a sperm count of less than 15 million in 1 ml of semen. As a man, you are supposed to, when you ejaculate, the volume of sperm is supposed to be 3 ml to 5 ml. So in 3 ml, in 1 ml, the number of sperm per male is supposed to be over 15 million. So if you ejaculated 3 ml of semen, you are supposed to have over 45 million sperm in 3 mils. And then in 5 ml of sperm, if you ejaculated 5 ml, you're supposed to have over 75 million sperm. What I did was multiply 15 million times 5, and yeah. So if it's 5 million, 75 million per one. If in a male you have less than 15 million sperm, you're said to be having a low sperm count. And there's also a more severe low sperm count known as the oligospermia. That is having, say, 5 million sperm in 1 ml of semen. Okay? You wouldn't know until you do a semen analysis. That is the only way you can tell this, because your sperm cannot be seen with your naked eyes. You can only see the semen, the one you ejaculate, but the content of the semen you can't see with your naked eyes, guys. So you must take care of yourselves, okay? Now, another one is aspermia. Aspermia means a dry orgasm, no visible sperm. You just ejaculate and you're not seeing anything, nothing comes out. A dry orgasm. The next one is hypospermia. I analyzed the number of male, the volume of sperm you should ejaculate, and we said it's 3 ml to 5 ml. But for hypospermia, you only ejaculate about 1.5 ml of semen. So if you're ejaculating just 1.5 ml of semen, of course, that means you will not have enough sperm in that semen. I'm sure I'm making a point here. So the next point is azoospermia. Azoospermia means no sperm at all. No sperm at all. You do semen analysis, you don't find anything. Yeah, this person ejaculated quite alright, but there's no sperm at all. There are a lot of causes to this. It's a very severe form of male infertility. There are a lot of causes, and one of them includes an untreated sexually transmitted infection. Untreated, like it's been there lingering on and you don't treat it, or you treat it wrongly. That's why I keep stressing the need of seeking a professional help, because that is the only way you can get the right treatment. Not going for over-the-counter medications. Seek professional help, and that's where you'll be treated rightly. Okay, and then the next one is atenospermia. Atenospermia simply means a large percentage of the sperm moves abnormally. They're not moving well. They are just not moving in the right direction. They're supposed to move straight. Okay, your sperm supposed to move in a straight line. So, but in this case, is either moving not in a straight line, it's either not moving in a straight line, or it's not moving at all. It's not moving at all. That's when they say you have actinozoospermia, it means the sperms are not moving at all, or they're not moving in a straight line. Then another one is teratozoospermia. Teratozoospermia simply means the majority of the sperm are abnormally shaped. Abnormally shaped. Your sperm is supposed to have one head, a body, and a tail. But then these ones are abnormally shaped. The sperm might have, say, 2 heads, or maybe 2 tails, or the head might be oddly shaped, not the way odd, like it looks odd, not the way it should be, not normally shaped. So that's why they say teratozoospermia. Then the next one is oligoathenoteratozoospermia. It's a combination of 3 in 1. Oligoathenoteratozoospermia. Low sperm count, abnormal shape and size, and abnormal movement. The sperm is not enough, they are not properly shaped, and they are not moving the way they should move. That's when you hear them use this term. Then necrozoospermia is a rare cause of infertility, where all the sperm in the semen is dead. All of them, not even one found, not one alive. And then leukocytospermia. This one is majorly an abnormality of the semen than the sperm. So when you find white blood cells in the semen. Okay, so that is it for today. I hope I did pass a message across to you. Please slide into my DM with any challenge, any concerns of yours. If you have any question in this regard, I can only talk to you when you come to me privately. Please slide into my DM with these concerns, and I'll respond to you. I'll be able to direct you in the right path. Do have a great day, and remember, health is wealth.